never give up. I never give up. I never give up. Turn around.
Hi guys, welcome back to Neff Inspiration, a show on YouTube and as a podcast with me, your host, Stefan Neff. Another fantastic day for an interview. And today is going to be an amazing interview because I've got Dr. Theodore Henderson with me. Theodore is a man who is going out there and is teaching old diseases new tricks, so to speak. He is a man who is not just taking things for granted as a psychiatrist, but he is asking very important questions that have led to very different new treatments and new treatment approaches and new ways of understanding things like depression, PTSD, long COVID, all those kind of things that really mess around with our heads. Well, in the past, we thought about neurochemicals, imbalances, those kind of things. And increasingly, we understand actually there's so much more to that. So today, we're going to take a deep dive into the new ways of thinking about our brain, about the challenges that we perceive each and every day due to either trauma in real terms, i.e., brain injuries, traumatic, or trauma due to indeed maybe infections, the long COVID, maybe other infections that are running subclinical. And what about the trauma that is really there on the emotional side due to the stress and to all the other not so nice things that are happening to us in our lives? So this is going to be an amazing time. Theodore, welcome to my show.
Thank you so much for having me, Stefan. It's a real pleasure.
Wow. I mean, you are a psychiatrist, and traditionally, psychiatrists have been more focused on the exploration, maybe the psychotherapy, maybe the use of medications. Can I assume that your traditional upbringing was really focused more on the old the I want to say old, but old is a negative word. Our previous understanding of how depression, PTSD, etc., is caused and what to do about it.
Very much so. I'm both an MD and a PhD, and my PhD work was in neurobiology. I was looking at how the brain organizes itself during development, and then my postdoctoral work was in how the brain repairs itself in the adult state. And so that naturally led me into thinking about psychiatry differently. I quite literally started out in radiology, but I got bored in radiology and left radiology for psychiatry. Haven't been bored since. But that combination of being able to look at the brain through radiological and nuclear medicine means and understanding psychiatry, that interwove to really lead me to think about psychiatric disorders in a different way.
And for those of our listeners who are not so clear about why an MRI or why these kind of things could make such a difference, ultimately the brain was always sort of a black box. It was very hard to measure, to actually crack someone's skull open and put electrodes in there. It's frowned upon nowadays. So therefore, the developments over the last 20 years really of imaging modalities, and especially the functional imaging modalities, where we can actually see certain parts of the brain, certain structures lighting up or not lighting up, for that matter, in various diseases. That certainly gave us a very different understanding of different circuits, different, like an electrician suddenly going through a house and trying to figure out what works and what not, whilst you're just looking at it, well, the lights don't go on. That's the difference. So beautiful. Excellent. Wow. So what were some of the early things that stumped you where you thought, wow, okay, we got it wrong? Or maybe there were better ways how to look at our standard understanding of psychiatric problems.
Yeah, like every psychiatrist, we get those cases that don't respond to treatment. And that they get labeled treatment resistant, and in many ways that's a pejorative word. It's blaming the patient. Why aren't you getting better? It's all your fault. And as I worked in the neuroimaging side, and we were using functional brain scans, what are called SPECT scans, or single photon emission computed tomography, SPECT, which is a nuclear medicine study that shows, again, what's working and what's not working in the brain. And we are looking at patients who were, they didn't get better with took Prozac, they took Zoloft, they didn't get better. Then they go and they say, something's wrong with my brain. Well, yes, indeed, something was wrong with their brain. And asking an SSRI like Prozac or Zoloft to fix a brain injury, it's not going to happen. But the frustration is there are no treatments for traumatic brain injury. There are no treatments for a diffuse, infected, or toxic-looking brain. What do you do for that? We don't. You don't flip up and open the DSM-5 and say, "Oh, here we go, toxic brain." You do that. There's nothing about that. It doesn't. It's not even addressed as a concept. So I got very frustrated by having to say to patients over and over again, you have a traumatic brain injury. We got nothing for you. Have a nice life. And so that led me to begin working with a colleague, the late Dr. Larry Maurice. And he and I brought together all of the science from Harvard and Mass General and Uniformed Services Hospital and University of Texas, University of Sydney, NASA, the Soviets, and looked at how we could take infrared light and take it from something that worked in a mouse and make it work in a human.
Which, of
that
course,
was the revolution.
And
say again?
No, this is just the amazing thing, isn't it? Here we go back. If you were to go back 100 years ago, what did we do with the tuberculosis treatment centers? Well, they were typically put somewhere into where there's sunshine and where there's fresh air. But it's the sunshine. It is those kind of pictures when you see all these beds being dragged out and the patients lying in the sunshine. So maybe a long time ago already, our forebears recognized that actually light is such a powerful treatment. And the same, I mean, if we were to look at the fact that so many patients get better when they walk in the forest, well, guess what? Infrared light, or near infrared, is actually abundant, especially in the greens around us. So here we see that actually nature is already trying to give us cues, but it took us quite a while to actually get onto that, isn't it?
It's exactly correct. And the amazing thing is when you look back at indigenous medicine, pick your continent, they were using the minerals, they were using the lithium in the water, they were using light, they were using combustion of certain roots that released things that we now recognize. For example, sweet Anne is now been repackaged as artemisinin, and has replaced chloroquine as the treatment for malaria. I mean, so if we just look back, we can learn a lot. Yeah,
Exactly.
I agree.
But then again, I mean, you have got so many variables that are affecting those natural things. So when it comes to herbs, you never know what the growing conditions of a herb is, therefore what kind of concentration of the good substances are there. And it's the same with light. It's sort of very difficult to quantify. But with modern technology, you have actually been able to be far more exact and far more precise. And because with light, there is such a huge spectrum of visible and invisible light for the eye. And some of them are really good, like the near infrared. And some of them, like the UV, is maybe not so clever, especially here in New Zealand, where our ozone layer is about that thick, and we've got the highest rate of skin cancer. So if I
Correct.
say to people, "Oh, go out in the sunshine," some people say, "You got to be joking." Um,
Mhm.
so tell me, what is the difference from your point of view with regards to the different light spectrums, and which lights should really be considered, whilst which maybe some of the light sources that we can purchase out there are maybe not so clever.
So it gets very specific. And so I'm going to deep dive with your audience here for
Come
just
on.
a few moments. The organelle in the cell where this happens, where this becomes important, is the mitochondria. Mitochondria is the energy production organelle
Mm,
within our cells. Now, neurons literally create electricity. I mean, that's how they function. So they're packed with mitochondria because they need to create a lot of energy.
mm,
Now, the mitochondria contain copper in much the same way as our hemoglobin contains iron, and the iron allows us to be able to grab oxygen and then let it go, and grab CO2 and let it go
mm,
in the opposite way. But the copper in the mitochondria allow for the transfer of electrons in the process of creating energy. So those copper atoms create certain pockets or certain sweet spots, if you will, for wavelengths of light. So there are key wavelengths of light within the infrared spectrum, around 800 to 1200
mm,
nanometers,
mm,
if you want to get specific, that turn on the mitochondria. Now, that produces more energy. Sure, that's great. Okay, more energy means the cell can work better. And if you've got a cell at the edge of a stroke that's limping along because it's barely getting any energy, giving it more energy may help the problem.
mm,
But more importantly, the infrared light activates genes within the mitochondria. They have their own
mm,
111 genes.
mm,
And the infrared light turns those on, and they send a signal to the chromosomes, turning on growth factors and anti-inflammatory factors. So in other words, they turn on growth factors like brain-derived neurotrophic factor, or BDNF to its friends,
mm,
and nerve growth factor and other growth factors, and as well as anti-inflammatory factors, IL-6, IL-5, we could go on and on. And those drive neuroplasticity
mm,
in the brain. They
mm,
drive brain repair in the adult brain. And so what we're literally able to do then is, if we can get that light to the mitochondria inside the brain, we can turn on neuroplasticity and you can see the brain repair. You do a functional brain scan before treatment, there's all these areas of the brain that are not working. You
mm,
do a brain scan after treatment,
mm,
they're working. It's striking. It's
mm.
absolutely striking. As a scientist, I am just blown away. There is a caveat. The caveat is that it's just not a matter of putting light on somebody's head. And this is where the danger comes. And I've written extensively about this. I've published several papers and book chapters about this issue. A lot of the devices right now are using a half-watt LED. And a half-watt LED works great for a mouse because, their scalp and skull is very, very thin. And so you can reach their brain. But, unfortunately, the human scalp and skull is considerably thicker, mine much thicker than most. So to get through human scalp, which is somewhere between, 2 and 8 millimeters thick, you need more powerful light, because that half-watt LED, it penetrates only about a millimeter into human skin. That's it. So it's great for growing hair. If you want to grow hair, put that infrared light on your scalp and stimulate your follicles. You have to still have follicles, sorry. And they'll grow hair. But you're not going to reach the brain. You had to have more power. And that's why we talk about multi-watt infrared light. So LUMIT is laser. It's a laser diode that's emitting the light, laser unattenuated, so it's not blocked by scalp and skull, unattenuated multi-watt infrared therapy. So I'll talk about LUMIT therapy, I'll talk about multi-watt infrared light, same thing, but it's different from just buying one of these little infrared devices and sticking on your head.
And in all fairness, they might very much have a role, because if you think at plastic surgery, or indeed in what's the word? Beauty treatments.
Aesthetics.
Exactly. So you have got these kind of face masks there that look quite impressive when there's a shining red light on ladies and men for that matter. And they are basically beauty treatments. They're skin deep, so to speak. And there is some evidence that they are doing something good on the skin. So absolutely fine. But it's important to distinguish how deep they indeed reach and what the effects are. So really, really good that you highlight that. Are these devices available to the public out there, or is that still something that is confined to the research or to clinics who invest tens of thousands of dollars into such treatment devices?
More like tens of millions of dollars and euros into the research. So the half-watt devices are being sold. And so you can buy a half-watt device, a hood that sticks over your head and hair, or a little device with little pads that go here, go back here. And there's two problems with that. Again, half-watt. And number two, hair is a wonderful blocker of infrared light. And we showed this in a,
then I'm sorted.
Yeah. You're a great candidate. We showed in a study that hair blocked 95% of the energy of infrared light. Yeah.
Wow.
So all these things that go over people's hair, I'm a lousy candidate because there's too much of that stuff up there. Now, so when we talk with our patients about, hey, it's, let's come get it, for example, I work a lot with veterans and first responders. We have a foundation that supports their treatment, so we subsidize their treatment. So I had a police officer from a city just south of here come in, and she had a traumatic brain injury, and she had been on her bed for weeks and weeks and weeks, just laying there in a fetal position, unable to take care of her children, unable to work. And so she comes in and we talk about what's going to happen, what's involved here. And I say, the hair is going to kind of get in the way. So, can you kind of cut it a little short on the sides? You need to get to your temporal lobes, and they're here on the sides. The rest of it, you leave it alone, it's fine. But I need to be able to get to the temporal lobes. And I love this officer. She shows up for the first day of treatment, Sinead O'Connor. She just shaved it all off. She said, Doc, I want to get better. Hair will grow back. And she did indeed get better. Her brain scan looks better. She's back to, living full life and taking care of her kids and healthy.
Beautiful.
Yeah.
Oh, wow. Okay, that's amazing. And these treatments, having said that, I mean, we are focusing on some fundamental processes within our brain. This is not something where you do a quick 5-minute treatment. This is something that will take time, inevitably, because when we talk about gene expressions, when we talk about epigenetics, when we talk about all those beautiful things that we can nowadays with functional medicine address, there is no quick fix. So sorry, guys, if you think, hey, great, I go once into, I don't know, an infrared sauna, just making it up here now, and that will now absolutely cure all my traumatic brain injuries and all the trauma and all the bad nutrition I've done for the last 45 years. Yeah, about that. Well, that might not work. So even with the best treatment, with the the best technology available to you now, what are the treatment timeframes for that?
Great question. Great question. So assuming we're working with our multi-watt device, and our multi-watt device is custom made for us. It has 4 wavelengths that we found to be key and it is hand delivered. I can send you a video of this. You can show people what it looks like. It's hand delivered. So this is hands-on treatment. And we're targeting the frontal lobes and the temporal lobes in most folks. But if the SPECT scan, if the brain scan shows a Gomer back here on the back of the head, we're treating the back of the head because that's where the damage is. The treatment itself lasts about right around 30 minutes. It varies depending on how I set the protocols up, how much pulsing there is, what the strength is. We sort of give X number of joules or units of energy. And we do the treatments about 2 to 3 times a week. Now, how many treatments does somebody need? Well, that's a hard one to answer because everybody's an individual, right? It could be 20, it could be 30, it could be more. But we quantify that. We don't just say, let's give you 30 treatments because that sounds good and it makes me a lot of money. It's not the way I do it. We do a baseline QEEG, which is a simple, inexpensive, functional brain scan of sorts. We do a whole bunch of paper and pencil testing. We do neurocognitive testing. If you have a TBI or a chance of one, we do a pupil reflex test and balance testing. So we have all these baseline metrics. We do 10 treatments, then we repeat the metrics. And, if the patients, their PTSD scale drops from, 80 something down to 12 and, they don't have any symptoms and their QEEG looks good, it's like, okay, you're good to go.
Brilliant.
In long COVID patients, we're seeing that, it's 20 to 30 treatments. I've got one patient who, she's back to work, she's doing well. She says, I want a little bit more talk. So she's come back in for additional treatments. And she's one of several people where we treated the chest wall as well because she had all these pulmonary symptoms. And remember I said infrared light, certain wavelengths reduce inflammation, not just in the brain, in the lungs as well. So just to expand this for just a moment, it's not like I'm the only guy doing this. Let's be fair. So Australia has a big group in Sydney under Johnstone who's looking at Parkinson's, doing amazing work. They have figured out if you pre-treat an animal on their back, not their head, on their back, and then give them a toxin that kills dopamine neurons, the dopamine neurons don't die. They survive. They're protected. So infrared light has a neuroprotective quality to it. And we're seeing that in our patients with traumatic brain injury. We have people who are still professional athletes. They come in, they get their concussion treated, they go back out, they get whacked just as hard or harder, and they do not concuss. Their brain is somewhat protected. So this is an area that's just emerging, that's just kind of coming out of the observations. But Harvard's looking at, they have a depression clinic. The military is looking at this. The VA
Theodore, it's not
looking at it.
It's not really it's not really brain surgery, I was about to say. It's not really surprising because we have got, from an epigenetic point of view, from all the crap that we are exposed to nowadays, all the toxins, all the chemicals that are washing into us in modern lives, they all do a number on our mitochondria. So our mitochondria are not pristine prior to the insult of either COVID or a traumatic brain injury. They're already hammered. They're already wrong. They're already just sort of barely hanging in there. And then you've got an insult. Surprise, surprise. So that makes a hell of a lot of sense. So, but then again, are we not talking about the ambulance at the bottom of the cliff there? By using your LUMIT down there, did you not just actually, without actually probably meaning to, saying, well, would that not be actually quite a prophylactic kind of thing to actually treat our mitochondria with the respect they deserve?
You've hit on a very, very interesting and insightful point. Most people don't get to that thought. Are you familiar with the fact that the brain actually does have a lymphatic drainage system?
Very much so.
Have you come
Yep.
across it? The lymphatic system. Probably somebody's already talked about this, so I'll be very brief.
No, no, no,
So
no.
the
Please,
oh,
start from basics. Only because I
all right.
don't know. Only because I know it. No, no, this is for my viewers.
Okay.
This is for
All right.
everyone out there.
So simply put, the lymphatic system is sort of a lymphatic drainage. So it drains toxins from the brain. It turns out that it works best when you're in stage 4 sleep. It works 5 times better in stage 4 sleep, even 7 times better in stage 4 sleep than when you're awake. So sleep is very important. And what gets worse when you get older? Sleep. What gets worse when you're depressed? Sleep. What gets worse when you're developing dementia? Sleep. Now, it turns out, and this is a study that was done out of Russia, so I don't quite trust it, but it was replicated by the same group at a German university, so it has a little valence. And what they did is they looked at certain wavelengths of infrared light, 980, 810, actually activate that drainage system. And so what they used a mouse model that had amyloid naturally, so kind of an Alzheimer's model. And applying the infrared light drained out the amyloid four times faster than the untreated animals. So there's this very important idea that not only can we protect ourselves, but this could be part of sort of that shift to longevity. Getting the toxins out, getting the tau out, getting the amyloid out before it has a chance to kill neurons and start dementia.
Nice one. And whilst there are, of course, nowadays question marks about the role of amyloid in its own right, it's probably more a marker rather than a causative kind of process. If we say that is a marker that we can clean out, well, what about all the other things that we haven't even got a clue about? But also, what about all those inflammatory markers, the inflammatory soup that causes the inflammation, the IL-6, all these kind of cell produced nasty things that are there originally really to get rid of bacteria and get rid of infections, etc. The police that is cleaning up our system. And unfortunately, they're a bit heavy-handed, the police. So in turn, they cause a lot of damage also in our brain. How about cleaning up all those kind of things? Wow. Okay. But I need to come back now. So here we've got with LUMIT, obviously a new approach, a highly functioning approach, but it's still not easily accessible to public out there. For the people who are out there, they hear, oh, I've got infrared sauna. And when you look at studies looking at infrared sauna, that makes people better too. So how can I interpret the fact that you're saying, well, actually, you need LUMIT to get into the brain versus I've got studies that show me that infrared saunas are good for me. So hang on, how does that work?
Yeah, we just did that study. So what we did was we sort of mimicked Gonzalez Lima's study where he's using a 6-watt 1064 nanometer emitter that he puts on the forehead. And he says, look, people get smarter. They do better on psychological testing. Their QEEG shows increased alpha wave activities. So what we did, we wired ourselves up for QEEG. And I'm literally talking about my co-authors and I. So the staff and the other scientists that I work with, we all sort of served as our own volunteers. And then we just put infrared light on our forearm, 1064 nanometer infrared light. And alpha waves in our brain went up by applying infrared light to the forearm. Indirect photobiomodulation. Now, the guy who gets credit for figuring that out is John Stone down in Australia. He's the first. Remember the whole thing about mice getting infrared on their back? protected their brain? Indirect photobiomodulation. There are a few people who did studies earlier looking at wound healing, but so we did this study, and it's so striking to me that we were able to turn on the alpha wave activity. And here's the kicker. So I, being the chief volunteer, I put a blood pressure cuff on my upper arm, inflated it to the point that there was no pulse, applied infrared light to my forearm, nothing happened. We then released the blood pressure cuff and the alpha wave activity shot up. So we identified that what's going on with indirect photobiomodulation is probably a bloodborne marker. We didn't prove it, but it's probably a bloodborne marker. Now, very small study, really, literally an N of 1, because I'm not going to subject anybody else to, putting a tourniquet on your arm for 10 minutes. But it proves the concept. So these low-level things and infrared saunas, these low-level devices are doing something. And their studies show, yes, kids with autism get a little less anxious if you treat them every day with a half-watt cap. Problem is, when you stop, all the benefit goes away. In contrast, when you treat with LUMIT, when you treat with multi-watt infrared light therapy, your depression goes away, your PTSD goes away, your COVID goes away, your TBI goes away. And I've followed these patients now for over 10 years. And they remain well.
Beautiful. Okay.
Yeah.
Well,
that's the difference.
And that's actually quite amazing to hear. So if we're now postulating, and it's probably modern postulation, it's probably pretty clear that the mitochondria are the key players with regards to many diseases, many challenges even that we are facing. If we look at low mood, if we look at the symptom complex of PTSD. So there are so many things that where really the mitochondria are under attack. Now, in the absence of LUMIT, there are other ways how we can actually strengthen our mitochondria, how we can give them the right nutrition, and how we can teach them to actually get rid of the dying crap that is accumulating. Things like the intermittent fasting, things like the nutrition approaches to actually strengthening the mitochondria. How much does LUMIT either excel compared with those approaches or can be mimicked with those approaches, whilst Joe Public can't actually get access to LUMIT or to other more advanced treatment modalities?
Yeah, poorly studied at this point, but I'll give you 2 examples. And the examples are chosen because we have a clear-cut brain scan before and after treatment. The first is a study in which police officers with PTSD underwent EMDR. And we have a brain scan before and a brain scan after. This is Daniel Amen's work. And after going through EMDR, the brain scan showed resolution of PTSD, so the brain was functioning better. The second study looked at football players, American football players. So all of them had, brain injuries because every practice they're getting multiple concussive events. And all he did was clean up their diet and get them to stop using drugs. And the brain scan before looked like, the brain had been pecked on by birds. And after treatment, we had a healthy looking brain.
Yeah. So we have got studies there that actually show us that, and we certainly
a little bit.
And we certainly, and whilst you're saying studies, of course, as doctors, we want to have ideally double-blind studies that really, really prove to us that is what is happening. But, life is not double-blinded. Life is a bitch, and sometimes you just have to do what you can do. So the role of intermittent fasting in starting off autophagy, i.e., that your body is starting to eat up those cells that are dead and are leaching maybe not such nice things, rotting,
Mhm.
rotting stink in your system,
Mhm.
cleaning that up,
Mhm.
those kind of things. That is something that Joe Public can do. We
Yeah.
can go into nature. We can do exercise that increases the blood flow and again helps us in a way of cleaning up the rubbish in our brain.
Mhm. We can improve stage 4 sleep,
Indeed.
and we can meditate.
Oh, very nice. Thank you very much. So there are actually so many things that we can do. But
Mhm.
what would you do if you were now transplanted to beautiful New Zealand, where unfortunately you don't get LUMIT, where you
Mhm.
don't have the setup that you have created in the States?
Well, and frankly, my goal is that, we have clinics throughout the world. I think that this is, absolutely revolutionary. And I think that over the next 10 years, whether it's me and my company or multiple companies, I don't care. The modality, people deserve this modality.
Mm.
And I'd be happy to come to New Zealand, any day. Um, Figure out how to drive on the other side of the road. I'd love to Zorb again. I don't know if they still let you Zorb the way that I Zorbed years ago.
The problem is
Uh,
that there's still some tourists who are trying that with not such good attempts. So we just need to protect you. We need to wrap you in a bubble and then take it from there. No, you come. No, but tell me, I mean, so what is your dream? Your dream is can we downscale the devices so that they are not 10 million?
yeah. Well, and I don't think, the devices themselves are not horribly expensive. It's just, and it's not challenging to really learn how to do this.
Mm,
I mean, the protocols that I've developed are licensed. I'm happy to license them out to people. I have multiple patents, and the idea is to get this to everybody, and make this available, because realistically, I mean, it's sort of like dentistry. Dentists started treating people with fluoride, and people stopped getting cavities, right? So literally, dentists sort of are putting themselves out of business. I would love to be in that position of putting myself out of business, where I treat people for depression,
mm,
and 10 years later they're fine. Whether and to be precise, whether that is with something like ketamine, which done correctly, and my book talks a lot about that distinction of doing it correctly, or infrared light therapy, but anything that turns on neuroplasticity
mm,
is reparative. I have patients who have meditated their way off of benzos,
mm,
off of anxiety meds.
mm,
So there are ways of strengthening your brain. Lumit is just part of it, but
mm,
I'll be honest, my dream is to put a clinic in every major city in the world,
mm,
um, because I think it's that valuable.
mm. Well, if we have got something that is indeed uh, highly effective, and it appears to be from your studies that this is the fact. The question is, with everything that is effective, is it too effective? We know that radiation therapy for cancer is effective. Thank you very much. It also gives you a beautiful free age injury, so it destroys everything in its path. It's basically a shotgun
Mhm,
approach to the tissue.
mhm, mhm.
And yeah,
Yeah.
oh, cancer is dead. All the rest is dead too. Doesn't matter. Um, are there side effects of Lumit? Are there
Oh.
problems
Mhm.
with that?
Yeah, great question. In our clinical experience, really the answer turns out to be no. We have, the occasional person who has a headache after the first treatment,
Hmm,
but generally nothing after that. Patients find the treatment relaxing. They say it feels like a warm breeze. And sometimes after the treatment, they're energized. And
hmm,
sometimes after the treatment, they're very calm and relaxed. It really varies from patient to patient.
Mm.
And, we're on the watch for side effects. We're on the watch for adverse events.
Mm.
And strikingly, we're just not seeing it. The adverse event with the low power devices is that when you stop, the symptoms start coming back.
Mm.
And that's the frustrating thing, is that, we need to, LUMIT seems like the necessary level of energy delivery to accomplish a lasting benefit.
Mm.
So that's, again, I draw that distinction. I'm working on the galley proof of a review article on exactly this thing. It's coming
Perfect.
out in Frontiers in Neurology,
Nice.
probably end of July, early August.
Oh, perfect. Because
Yeah.
that's always the key question with any kind of modern treatment. We have seen that with the use of ketamine, high dose ketamine in cases of complex regional pain syndrome, of indeed the emerging role of ketamine in the treatment of therapy refractory depression. So we know that in theory, there is actually, not theory, from case series, we have seen tremendous improvements. But there is
Mhm.
also concerns that if you use high dose ketamine, that there are, it's basically a ketamine coma, the way it has been used by some researchers and for complex regional pain syndrome, and that it has got a mortality associated with it because it's essentially a multi-day general anesthetic. And there are concerns with regards to cells that are not supposed to die dying. And I mean,
Mhm.
what do you think about those kind of things? What is the where are we going here? On the one hand, we want to explore new techniques that maybe are giving hope to those people who have no more hope. Traumatic brain injury, severe therapy refractory depression where nothing works, where ECT, electroconvulsive therapy has failed, everything has failed. And, people are saying, oh, well, tough. And, where are we with that?
Yeah. That is a large part of why I wrote the book I wrote. And what I talk about in the book is that there is no need to push the dose. In fact, it's wrong-headed.
Mhm.
Low dose ketamine, the way that I use it. In fact, I've opened the first clinic in Colorado, was the 13th clinic in the United States. I've been doing this for 12 years. In 12 years, do you know how many of my patients have had a hallucination? One.
So, okay, for those people out there, ketamine, vitamin K, it's used heapsly in the recreational drug scene. That is known for that, and it is used as a horse tranquilizer, which is actually not really true. We use it in anesthesia commonly, and it is a beautiful drug at low doses to actually calm down neuropathic pain, nerve induced or nerve supported pain. And it's wonderful. And if I want to send someone asleep, that's about 2 milligram per kilogram, give or take. So about, let's say, 150 milligram, that would definitely send someone asleep for 15 minutes. To run it, and that also is sometimes what you find in some of the tablets that are out there that are supposed to make you high, which is actually quite dodgy. Um, the doses that we are using for pain in the hospital, we run it as an infusion, and it would be somewhere between 2-4 milligram per hour, maybe up to about 8 milligram, 12 milligram per hour. That is what we do, and with that we see very few hallucinations. Is that about the same ballpark that we are talking with you?
No, not at all. Because what I'm going for with ketamine is to turn on brain-derived neurotrophic factor. And that happens at very low doses. So I love that you said to your audience, we're going to do some deep dives, because literally the back chapters of my book are called deep dives, where I get into the science nitty-gritty. So I'm working at 0.5 milligram to 0.7 milligrams per kilogram.
Per kilogram,
Okay,
right.
per kilogram. So 30% of what you're doing.
No, we are
And
not. We are 2 milligram per hour.
2
not per
milligram per
kilogram.
hour. Oh, no.
Ah,
Okay.
okay, so that's lower.
Yeah. Okay.
But it's
And
interesting.
great.
So you are actually, so for let's say 100 kilogram man, 50 milligram per hour.
At most. Yeah,
Yeah,
at
cool.
most. And
Gotcha.
we'll dial in that sweet spot. And we'll do that infusion.
Yeah.
And we'll say, okay, come back in 2 weeks. Not
Uh-huh.
not you got to get 3 infusions in a week for 2 weeks. You got to get those 6 infusions in. That whole 6 infusion in 2 weeks thing for depression,
Uh-huh.
that came from the original multiple infusion studies. Now, one of the first ones was done by a guy named Sharoma. So I said, well, he's a smart guy. He's at Yale. Maybe I had to ask. He must know something I don't. So I emailed him and said, okay, why 6 infusions in 2 weeks? His answer was, I don't know. It sounded good. Literally. That was the science, guys. That was the science.
Okay.
So I have a 70%, 73 to be technically correct, 73% response rate in my clinic, giving people ketamine at most
Yeah.
once a week. The national average in US across 3 studies was 52%.
Exactly.
Okay.
Exactly.
So focusing on the neuroplasticity
Yeah.
gets a better result.
How long do you run the infusion?
Generally 40 minutes.
What? It's
Yeah.
nothing here or there.
Yeah.
Bolus?
Yeah.
Bolus
No,
before?
it's on a no
Yeah.
bolus. Just
Right.
it's nice, smooth drip.
Interesting.
Nobody hallucinates.
Mm,
Everybody's comfortable. No nausea, no side effects.
And the reason that I'm asking that is because some of these treatment protocols are meaning that you're there many, many hours, which is translated into a nurse being there for you, and then that is translated into dollars. So therefore, if you were to look at the costs of such treatments, it is often phenomenal. I mean, give an example of hyperbaric oxygen treatment, which is another wonderful, wonderful technique for certain indications. As I'm a dive doctor, I'm a hyperbaric physician. So, but yeah, you need about 12 treatments before your body learns to produce new blood vessels into areas where there were very few blood cells going. And, but it takes time. And these treatments are 2 hours each, and they go 6 days a week. So that's a hell of a lot of money for an insurance to pay or for you privately to pay. So therefore, we need to
just time commit.
correct,
Just time commit.
correct.
Okay?
So you're talking 5-6 weeks for many treatments there, and that's hard. Now, if that is between life and death or between severe handicap for reasons whatsoever, osteonecrosis or your bone is falling apart because of radiation treatment, things like that, well, yes, then these kind of things work and make sense. But wouldn't it be nice if we have less invasive and maybe equally effective things? So, I mean, horses for courses. You can't compare, oh, okay, LUMIT I can't do, but maybe I can do hyperbaric oxygen. It doesn't work like that, guys. So let's be clear about that. So it's a relatively short treatment. How much is that accepted, and how much is that still fringe voodoo kind of things that we want to stay away from? Or how much is that changed? If you were to go to present to a psychiatric conference, are people still rolling their eyes?
So great question. Yeah, and it depends on the conference. Harvard Mass General has a photobiomodulation grand rounds once a month. I presented there twice. And Paulo Casano, who is now running the facility at Harvard, he and I have published a couple of papers together. And the field is beginning to make that turn. So Harvard has a clinic. There's a couple of other clinics that are opening, but they're using very low power stuff. They're not using the multi-watt technique that the LUMIT technique that we're using.
Yeah.
But we're talking about a study. It's again multi-million-dollar federal grant, hopefully, that would cover this study to really look at what LUMIT does.
Yeah.
And we're going to specifically start with traumatic brain injury.
Yeah.
But I'm desperately curious to do the study in Parkinson's disease
Oh,
because we have patients that we've treated with LUMIT and they're now 10 years past treatment and they're on the same dose of Parkinson's drugs. They
beautiful.
haven't had that steady increase that everybody experiences, right? And so there's so much that I think that infrared light can be helpful for.
Yeah.
And there's a huge community. This is a huge community working in photobiomodulation.
Yeah.
So multiple studies on autism out of Israel, in the UK, and out of the US. Australia is focusing a lot on Parkinson's, but they're also looking at Alzheimer's. And so it's a huge community now. And so if I were to, go to the APA, I'm pretty sure they would reject it the first time. I mean, they barely did a presentation on long COVID. They had to kind of sneak it in the back door to be able to talk about long COVID at the American Psychiatric Association.
Oh,
And
that's
remember, the
silly.
American Psychiatric Association is the group that put out a paper saying there is absolutely no reason to do brain scans on patients for psychiatric reasons.
Okay. No,
Yeah.
yeah, well, exactly. And I think that it's hard because the two of us are laughing in a knowing way, when in reality, many of the psychiatric diseases are in fact have maybe a biological reason. There's only because your mood has changed, only because you have got suddenly waves of anxiety washing over you. Well, that's not just neurochemicals. So yes, the neurochemicals are causing that, and we can measure them. But it is what about an infection, or what about I mean, the classic example would be an encephalitis, viral or bacterial infection of the brain, its brain structure itself. Well, guess what? You are loopy as hell. Well, from what the infection there. So, and how else do you figure that out than maybe more invasive, either sampling of the fluid that is around the brain, or indeed imaging? So let's be clear about that. So yes, there is always the kind of more traditional approach. Psychiatry, i.e., is still imbalances of neurochemicals. We need to talk about trauma. We need to go back to your childhood and see what your mom did to you. There is. I talk like a cliche here, but there is still a strong belief in these talk modalities, in these talk therapies. Whilst they definitely have got their place, there is, I think, we have got also an opportunity to look at the brain as a beautiful, beautiful, beautiful thing that is very much alive. It's not that we've got all these brain cells that are laid down at birth and that's it, and then from then on they die. Yeah, once upon a time we thought that. Nowadays we know neuroplasticity is something that we can actually influence by our choices. You can either hammer your brain with, kill a few thousand every day via diet, toxins, alcohol, your behaviors like playing rugby or American football. There you go. Or we can actually also improve them. And I think that is where you are coming from. You are a beacon of hope there. You are saying, actually, we can change lives. We can change the lives of people who the more conventional psychiatry has given up on, or saying, well, we just can't do a thing here. And I think you are exploring, you're going outside of the of the box, outside of that box, as well as outside of the figurative box. My goodness.
Absolutely.
Where do you think is the future? Where do you think? I mean, you want to have one of your clinics in every major city, and I actually love the idea. But where do you think? What are the next frontiers that we
Yeah.
will see?
Well, So I'm going to put a shout out to Ruth Azaki. Ruth Azaki, she's now at Oxford. She is an English researcher who 18 years ago made the connection between the cold sore virus, herpes 1, and Alzheimer's. Nobody believed her. She couldn't get her papers published. She couldn't get research grants. She was just blasted and blasted and blasted.
Yep.
And one of the secret silver linings of COVID is that now people get it. They get that a virus can cause an acute illness and then cause something that lasts for years and years and years. I mean, here in the States, we have these commercials about getting the vaccine for shingles. And it says, do you know that shingles is sleeping in your body? It's in your cells and it's been there all along. And one of these days it's going to wake up. I mean, the commercial writers get something that my fellow doctors do not understand. And the reality is, one of the revolutions that's happening and going to continue to happen is we're going to recognize the role of viruses and other latent infections, Bartonella, Borrelia, Babesia, in disease, in psychiatric disorders. You know, I could give you very cogent examples of that.
Oh, absolutely. I mean, you've got here Lyme disease. I mean, that is such a prevalent thing in the United States. Epstein-Barr virus. We've got so many viruses that are playing havoc with us. Now, some viruses are really good. It's just as much as we have learned about the gut microbiome and the many other microbiomes on our body, that there are some really, really lovely dudes in there that we really want to look after, from the gut and from the mouth microbiome, etc. And if we mess around with them, well, we pay the price. It's the same with viruses. It's the same with fungi that are living us. And there's so much that we don't know. But equally, I love it that you point towards that, because we are now recognizing increasingly that the world is far more complex, that our ecosystems within our brain are far more complex, and which is a good thing too, because it means, like a big spider web, we can start pulling a bit here, pulling a bit there, pulling a bit there. What was to happen if we actually look for mycotoxins and find out that you're actually living in a house that is full of black mold? Well, okay, and what about the glyphosate in your food? And what about the heavy metals? And if we were actually now start detoxing you, and where we start putting actually healthy habits in place, what about you addressing your sleep? What about, and now you're starting working on all those kind of things. Suddenly things get dramatically better. And that is our choice. We are no longer victims to our environment, but we actually can start taking control. I think that is your scientific realizations give now credit to those kind of more common sense things that people have said for a long time. But nowadays we've got studies that actually can show, okay. And I think I love to hear that from you, Theodore. I love to hear that. Wow. Theodore, your book, please show us your book.
Okay, sure. Halfway. So Brighter Days Ahead.
Beautiful.
And the cover was actually designed in New Zealand. Shout out to you. And the book it talks about ketamine a lot, but it's not a book about ketamine. Ketamine is a model. It's a model of a way of turning on neuroplasticity in the brain. And so I really poked huge holes in this whole serotonin chemical imbalance theory, which is frankly hogwash. I don't know if anybody has in your audience has ever actually washed a hog, but lots of SHIT comes off.
Okay, now I know where that comes from. Thank you. I learned something.
And I talk about how patients get better and stay better if you treat them through neuroplasticity, not just chemicals. And one of the chapters, I focus on one patient, and it captures everything you were just saying. It wasn't just giving her ketamine to make her better, but that was a start. I mean, a coupon saved her life. it was then recognizing that she had Epstein-Barr virus in her brain. It was then recognizing that the childhood trauma that she had experienced threw her entire body into this immunological firestorm. And so
Exactly.
calming down her immune system
Exactly.
and doing body work,
Mm.
Shout out to, the body keeps score. And that kind of work, it was a series of work for her. So she's now at this point where she's, lives part-time in California or Colorado and part-time surfing in Mexico. Perfectly
Well,
happy.
yep. Oh, beautiful. And I
Yeah.
think that just shows, and that is the power that we can give back to each and everyone out there. We are no longer the victims, but you have to do the work. There is no magic pill, there is no magic intervention. It just doesn't work like that. But there are many, many interventions when you stack them and when you actually just invest 1% of your day into actually looking after yourself. Very soon you develop an addiction, and the addiction is to feeling better and to improving and to growing as a human. And that is beautiful. That is the addiction that I love to foster. I'm an addict. Hey, come on, give me an addiction. Give me one. But right now, the addiction to living my life to the fullest. Now that has taken hold. And I think you have certainly opened up a lot of little windows in my soul, in my brain, where I'm reflecting and actually saying, huh, what he said actually made sense. And that was actually quite a good point. So if I will not be the only one who has got these kind of revelations. If people want to know more about you, where can they find you?
So our website, neuroluminance.com. So neuro, Neuro hyphen luminance, LUMINANCE. Neuroluminance.com talks about the infrared light. We talk about brain scans. There are testimonials by people who've gone through treatment, whether it's long COVID or depression or TBI. It's also worthwhile to look at the Neuro Laser Foundation's website, and that is tbi.care. So TBI, traumatic brain injury, tbi.care. And there you can see, some long lectures by myself and the late Dr. Maurice about infrared light and why we care about veterans and why we care
Yeah,
about first responders.
yeah.
Speaking of first responders, a movie was just released. You can pull it up on YouTube if you Google residual and PTSD. This is a great movie about the trauma that first responders experience. Just doing the job is traumatic. Seeing the things they see, dealing with the situations they deal with. And one of our patients is featured in that, and
Oh,
he's a
wow.
beautiful man. It's our honor to treat him and to subsidize his care because of his service to the community.
Beautiful, beautiful. Guys, look down there into the description of the YouTube video and of the podcast, because everything is down there, all of Theodore's links. Theodore, you're an amazing man. You are, I love your energy, I love your insights, I love your aura. You're using your energy to bring quite complex scientific principles uh, to available. You make them available to everyone. And I think that is the way how we can grow, how we can share knowledge, how we can demystify our mental health challenges that are affecting an increasing amount of our populations, irrespective if that is the United States or New Zealand or Europe. The world is, yeah, not a good place at the moment. So the more we see that we are in trouble, but that we can do something about it, that is powerful. So thank you very much for giving hope. Thank you very much for the work you're doing. I can't wait to see more work coming out from you and see where we are going in the future there. Maybe we should organize in a year's time a follow-up interview, because no
That'd be
doubt
fantastic.
you will have exploded. You will have grown inevitably because you have been bitten by this bug, by this infectious disease of wanting to know more and exploring the boundaries, maybe challenging those things that we thought that were true, which might not be so much so. So, Theodore, thank you very much for the work that you're doing, and thank you very much for having come as a guest
Oh,
on my show.
you honor me. Thank you so much for the very
No.
kind words. I would love to come back. We can talk viruses. We can talk chronic pain syndromes.
Oh,
Yeah.
no, absolutely. You're on. Okay, you're on. I'll take you right now here. That's a promise. And you guys out
Excellent.
there, please look after yourself and live with intention. Bye.
I never give up. I never give up. I never give up. Turn around.